Air pollution kills more than 1.1 million people in Africa, making it more deadly than malaria, HIV, and TB combined. That's why it is important that you know a thing or two about the air that you breathe. Welcome to Talking Science Africa, a show where we bring you science and researchers, explain the work that they are doing in a layman's language that you can understand. Today we are hosting Professor Engineer Bainomugisha, the founder of AirQo, an innovation project at Makerere University that is tackling the issue of air pollution in Africa. Professor, welcome to this show.
Thank you very much for having me.
Air pollution is becoming a big thing in Africa. And for me, whenever I'm reading research articles, I come across the work that people are doing in this area. For instance, there is a recent study which I highlighted in my newsletter, in which scientists in South Africa actually used black mamba snakes, try to understand the air pollution in Durban, South Africa. They looked at the skins of the snakes and the chemicals that these snakes were putting. And from that point, they could tell the air pollution in this and that area is at this level or that level. So there is a lot of interesting work that people are doing of recent. You find a lot. But for you, you started 10 years ago. What made you pick interest in air pollution 10 years ago? And give us a brief explanation about this project.
Yeah, thank you. As you just said, air, as obvious as it might seem, it's very important to all of us. You might live a few days without food, but every human being, you cannot survive a few minutes without air. So air is very important to human health. And as you just pointed out the numbers, if people breathe polluted air, then we get sick. People lose their lives, or people live shorter lives, but also the nature, as you are pointing out, the ecosystem, like snakes or even plants, they also suffer from this. So the question is, if we see studies and an indication that our air quality is polluted, so what can we do? And this really motivated the start of AirQo. So AirQo is a project we started here at Makerere University in this lab here, and the sole purpose of AirQo is to deliver clean air to everyone in Africa. That's our vision, having clean air for everyone in Africa. And for us to achieve that, we strongly believe that the first step really is we have to have the data and information to know the quality of air that we breathe in. If you want to drink water, typically the water, you can look at it and have some good measure that maybe this is clean water, especially bottled water. But for air, we don't have that privilege that we can go out and buy a bottle of clean air. So it's very important for us to have the technology to actually be able to tell us the quality of air that we breathe in. And coming from computer science background, our motivation was really, what can we do with the knowledge we have, the technology we know, to make the lives of people better. And there's no better way to impact on everyone's life than actually cleaning their air, because everyone needs clean air.
There are always smaller things that inspire people to start projects that grow big. What inspired you in 2015 to start this project?
Yeah, the main inspiration really for starting this project comes from the personal experiences. Having lived in Kampala City, first-hand experienced the air pollution, but also having the opportunity to actually learn about technology. right from undergraduate up to the PhD level in computer science. And then, having this drive on how can we actually leverage the knowledge that we have, the knowledge that my team has, the knowledge that I have, to actually tackle a problem that affects everyone. So when we started out in 2015 or thereabout, we really wanted to understand what the air quality was in the city. And we did a few asks around responsible agencies. What is the air quality? There were a few reports that were indicating pollution is very high, but there was no data. Everyone seems to say air pollution is bad, but there's no data. And then when we try to ask, where's the data, one of the main constraints we are told is that the cost of equipment to actually monitor air quality is very high. And this made me, think then, what can we do as people who know the technology? Can we actually create the technology to address this cost gap and this data gap? And that's how we started AirQo.
In Uganda, you started in Kampala. 10 years later, where is this project's footprint across the country?
Yeah, so when we started out, as you say, we're in Kampala, we are thinking about air pollution in Kampala, how do we contribute a solution? And, we started out, with 1-2 devices in the labs. At that time, we were thinking, how do we cover, the whole Kampala with just a few devices, 1 or 2 devices. And we put some of those devices on motorbikes over the borders, which gave us, a huge coverage of the city with a few devices. But fast forward, we actually came to realize that this problem of air pollution is not only specific to Kampala. All the cities in Uganda, all the cities in Africa, they have the same problem. And this has, enabled us, the demand and the need for the similar technology has pushed us to scale AirQo beyond Kampala. We are currently in Uganda. We are in several cities, including Jinja, we're in Fort Portal, we're in Gulu, we're in Mbarara, and other cities within Uganda. And across Africa, we have expanded to almost 15 cities across Africa in 10 countries. We first were, outside Uganda, we first scaled out to Kisumu in Kenya. Later we scaled out to Nairobi, still in Kenya. We got, request and demand to expand to Lagos in Nigeria. We expanded to Douala and Yaoundé in Cameroon. We did some pilot expansion in Senegal, in Madagascar, in Ghana, in Burundi, South Africa as well. We've done pilot expansions there. And the demand is really, growing because we have many more requests to actually expand our network than what our capacity can handle at the moment.
Amazing. How many machines have you deployed across the continent? And explain in layman's language, I have seen these machines here. How do you make them and how do they work?
Yeah, so we have a network of over 500 nodes across the continent. And in terms of how these devices work, the primary goal of these devices is to be able to tell you the quality of air that you are breathing in. So unfortunately, when you look outside the window, you might think that the air quality is clean, but actually it's not. There are pollutants that actually are very concerning for human health, what we call particulate matter. Particulate matter is basically small particles that are very tiny that you cannot easily see with a human eye. And when you breathe them in, they bypass your filtration system and they get into your blood and they can distribute to your body organs. And when these concentrations go beyond certain levels, then you're going to get sick. Children will get sick and other conditions will emerge as we hear from the medical experts. So the primary goal of the device is really to actually take an air sample and tell you how good or bad the air is. That is the singular purpose of this device. But of course, for that to happen, there are many things that have to, to be done in the process. Because for the device to give you that number, that air is good or bad, it has to be able to take an air sample. And this device continuously takes air samples from the atmosphere and then tries to compute the concentration of the pollutants in this air sample. And then it does the aggregation. So every about 90 seconds, it sends this data into our systems. And then over time, we are able to kind of understand the trend of air quality. Because the air quality might get polluted just in a few seconds, but that's not a problem. It becomes a big problem if the pollution remains high over a sustained period, because that means that if you're a human being, you are seated in the same place, you are breathing in that polluted air for a long time, and your body system, will get stretched, you will get sick, you will get ill. So in short, this device is a way, the same way you have a clock that will tell you what time it is, you have a device that tell you what is the quality of air you're breathing in at any one moment. And imagine that power, the ability, if you're a government, the ability to actually know the quality of air your people are breathing in. Because if you really care about people's health, then you really should know what people are breathing in, because every human being, wherever they are, as long as they're alive, they must breathe in. And therefore, it's very important for us to track the quality of air they are breathing in, and if it's polluted, then we need to act to make it clean.
You have collected this data for 10 years, which is amazing, and I hope you have too much of it. What does it say about air quality in Uganda, in Kampala and other cities? What have you been able to learn?
Yeah, thank you. What we have seen in the city is that, first of all, is that the air quality, varies in space and in time. In space, what I mean is that if you're in this location, it's in Kampala, if you move 1 kilometer away, the air quality tends to vary. In time, it varies in the sense that if you take the measurements, if you look at the data from 3 a.m. in the morning through the day up through 2 a.m. in the night, you actually see a variation of air quality. And this is one of the things that we have seen. We have observed actually across the different locations in Uganda, for instance. If we look at all the data, the trend is strikingly similar. Air quality gets bad from early morning up to around 10, drops a bit and picks up again late in the evening. So this, regardless of the location, we see this trend. Air pollution varies across the day. And then the other trend we see is that different locations have different profiles of air quality. But the location that tend to have slightly okay air quality, of course, they have certain profiles, like green space, maybe less traffic, less human activity, that tend to be less polluted. But on the whole, it's very difficult to find a place in the city that actually has like the air quality that would say meets the World Health Organization standards. Most of the places, on average, they are above the recommended standards of air quality. But what we see is that some places are worse off than the others. For instance, if I take a place, we have one of our stations here at the university, just a few meters from here. And what we see is that in general, the air quality around the university tends to be, moderate. But on the other hand, if you take other places, let's say in the city, like in Zambia area, or Busega area, or Chireka area, the concentrations there tend to be higher because of the human activity, the vehicle activity and all that. When we look at the data on the wall, we see that there are some places that are as high as 6 times what the World Health Organization recommends, and some places as high as 12 times what the World Health Organization's what World Health Organization recommends. Because what we have is that because of the importance of air quality, the WHO or the World Health Organization, they come up with like guidelines on what they consider to be acceptable. And they will tell you that maybe on average, if you're looking at particulate matter, one of the pollutants, what's called particulate matter 2.5, it should not exceed, the average should not exceed 5 micrograms per cubic meter. That's a concentration. But if you take maybe average Kampala, you find most of the places they are maybe around let's say 60. So 60 is 12 times higher. There are places that or there are some places that of course fall below that, but there are places that also fall above that average. And we've also been looking at the data. We've been analyzing data over the years. We also see that there's a bit of a trend the years averaging around from the 40s up to around the 60s, 50s in terms of the annual average in the city. Again, here this is varying per location, but on the whole what we see is that the air quality, yes, it varies. There are some places that are like moderate. There are places that they are really what we call unhealthy. But on the whole, our air quality needs attention. We need to improve our air quality. I think the important thing is that we now have the data. We can see how our trends have been. Like for instance, when we looked at the data, we can see that around 2020, 2021, we had a slight drop on the annual average of air quality in Kampala. But then we've seen it starting to move up a little bit. Of course, part of it is contributed to the heavy lockdowns we had during the COVID time. I mean, it's not the ideal that we have to lock down to improve the air quality, but also demonstrates that actually, if we take some actions around our transport and human activity, we might achieve some gains on air quality.
Okay, thank you. I may ask you once again from this data, can you point out some areas in Uganda, in Kampala, that tend to consistently show poor quality, poor air quality?
Yeah, so that's, as I explained earlier on, I think what the data shows is that regardless of the location, as long as the location has certain profiles, if the location has a lot of human activity, let's say cooking, human activity in terms of transport, vehicles, less tarmac roads, regardless of the location, you will have high concentration of those pollutants. And I already mentioned some of these, like if you look at the stations, it's around the Zambia area, around the Busega area, or Chireka area. I mean, these areas have these characteristics. They have these profiles. They are very busy. High population of vehicles, moving all the time, human activity. These tend to drive the emissions high. So these come through as, high, one of the locations that have high concentrations of emissions.
Looking at the data of 10 years, what has changed? We talked about the trends. At some time during the COVID, the numbers went down in terms of air pollution. So if a person asks you between 2015 and 2025, what has been the difference in air quality in Uganda?
Yeah, so as I said, we looked at the trends. I think we've seen a slight drop in those few years of COVID, and then after that we kind of started to see a slight decline again in terms of emissions, going up. I think one thing I have to say is that air pollution, it's not like maybe water. Some problems are a bit easier. So because air quality is ambient, atmosphere, and many things, we cannot wake up in one day and say we want to have clean air and have it. I think what we see is that we have not had a significant gain or improvement in air quality, but we've seen a few periods over this time that have achieved some drop in terms of the emissions, improving in air quality. But in terms of the space, I think there are some successes also to talk about. One thing is that increasingly we see that there's awareness of the problem and people are accessing the air quality. It's not the level we want, but I think now if you look at our platforms, we have thousands of users accessing the data, accessing the AirQo mobile app, users tracking the air quality they breathe in. I think that's really good. It kind of shows that people are starting to pay attention to this. And also a few media reports that have actually tried to pinpoint this problem. But also most importantly for us, having in this space is actually the regulation or the standards that were passed by the government regulating air quality. That was last year in May in 2025. The government of Uganda through National Environmental Management Authority coming up with a regulation on air quality. I think that's a significant milestone. I think now what we need to see is how do we actually see the implementation of that, because the regulations have come up with standards which are slightly higher than what the World Health Organization would recommend, but they kind of provide a mechanism for us to track how we are progressing. And over time, we've also seen a few examples, not only for individuals accessing the data, but also a few industries coming to us and say, can we start monitoring air quality around our industry? And being able to generate reports on how the emissions are around the industries. I think these are some of the changes we are seeing in terms of the numbers, but also in terms of the ecosystem. But we hope, because for us to clean up air quality in Uganda, in Africa, it has to be a collective action, because there's something I can do at my individual level to clean up my air, but there's also something I can do at my individual level or your individual level to actually pollute the air. So how do we collectively do more of the things that improve our air quality and less on the things that pollute our air quality? But also knowing that even if Kampala is doing everything right, if the neighboring cities are not doing the same, even the Kampala air quality might not get clean, because we also have what we call imported air quality. Even when the whole of Uganda does the right thing, if the neighboring countries do not do the right thing, we will still be able to get pollution here. So it's a complex problem, but we can do things at individual level, at the government level, but also at the regional level to ensure that we can have clean air.
That's very true. For a fact, I know that we export a lot of air pollution to Europe and South America. Africa exports a lot of air pollution to Europe and South America, and they're always concerned about that dust that comes from the Sahara Desert. Everyone in Europe is always trying to measure what is coming, how bad is it, and it isn't.
Yeah, that is true. That is true. That's what's called transboundary air pollution. Like even if you do everything right within your country, if there's not collective action at the regional level, then there's some emissions you cannot, or the pollutants you cannot control. So that's true.
So Uganda has come up with an air quality law. What are we seeing across the continent? Countries coming up with such regulations. Was the one in Uganda the first of its kind? What are countries doing?
Yeah, as I said, it's very important that we have, regional collective action on air quality issues. There are some, Uganda, we are fortunate that we moved a step further. I think if you look at different countries, they're all at different stages. I think there are some countries that, have had regulations before, that they are maybe reviewing them. If you look at a country like Ghana, they have had air quality regulation for a long time. I think they've been reviewing it now. If you look at Nairobi, Kenya, they kind of run a different system because they have like this county system where counties can also like create their own regulations. I think they're also in the process of like, reviewing some of the regulations they had. At the East African level, I know that there's an effort to have an East African kind of regulation around air quality. So that's promising. And a few years ago, we participated in the UN Environmental Assembly in Nairobi. And one of the key things that was done there was actually a resolution on regional, air quality management, which kind of requires all the member states to, take actions around air quality in terms of course, monitoring, but also regulations and other initiatives to, improve the air quality. And as AirQo, we're also privileged to be part of, the UN convened initiative called the Clean Air and Climate and Clean Air Coalition, CCSC, where we are a non-state member with other, members across the world, where different countries and entities are actually discussing what can we do at the international level to ensure that we are actually all making progress. Because as we say, no one will achieve clean air without their neighbors and the rest of the world achieving clean air.
Let me take you back to the data because I think that's the biggest asset that you have here. And beyond Uganda, you have monitors in, you said 14 cities across the continent. What are you learning from those cities in terms of air pollution?
Yeah, that's an interesting question. I think one thing to know is that usually when you talk about air pollution, if you don't have data, it kind of remains like an abstract concept. And I think what we have seen, if I take an example of Lagos, for instance, when we reached in Lagos, started a collaboration with the University of Lagos and Lagos Environmental Protection Agency, which is like the equivalent of our NEMA here, but in Lagos State. And what we've seen there is that when you have data on the state of air quality in any city, you can start the conversations. Conversations start to get real. In Lagos, one of the things we've seen is that when we set up the network, we started collecting the data. LASEPA, which is the Lagos Environmental Protection Agency, they started, disseminating this data on their website, on their social media to the public. And that started to generate conversations and also bring along other stakeholders. When we had the convening in Lagos, we had, sectors from transport, health, all coming together, but because of the data. And what we've seen is that once you have the data, you can actually start to have concrete conversations, and you can also start to see actions moving forward. And also, it kind of makes it real and makes it possible that actually people can discuss this problem and can also see what they can do, with the data to improve air quality.
I still for sure want to get a lot of insights from your data. For instance, how does a city like Kampala compare with Lagos, compare with Accra, or even Nairobi in terms of air quality? Do they have the same profile?
Yeah, that's a good question. I think it's always, I think it's one of the things I think we have seen in the communication that tends to I think provide an inaccurate description because air pollution, unlike other parameters, as I said, it varies greatly within a city. So it might be misleading, like do an average across the city. I think what we see when you take Kampala, you take Nairobi, you take Lagos, you take Kisumu, you take Accra. I think what we see in all these cities is that these cities have a mixture of profiles. They have places that are very, very polluted, and they also have places that are clean. Even within Uganda here, obviously when you look at across the numbers, maybe in terms of frequency, where most locations might have cleaner air. If you look at, let's say, Fort Portal and Jinja, and Kampala. But even in Fort Portal, in as much as, on average, you kind of see more clean air there, you still see hotspots within Fort Portal that have cleaner air. So I think it might be misleading to characterize one city as being polluted more than the other. But I think what importantly we're seeing is that each city in Africa that we are in, it has many locations that are actually exceeding the recommended standards by a factor. What we try not to do is to kind of do an average of the entire city and then rank each city. I think in the end, we want to ensure that our data is actually used to empower cities to act and not make them look like they have like the worst air quality and people are scared.
That's what I want to tell you, that we start a ranking of African cities in terms of air pollution.
Yeah, I think my opinion on that would be that if we should use the data to actually showcase where cities are doing well and how these examples in the places within a city are doing well, how they can be scaled to other locations, and less on profiling certain locations as this is the most polluted. Because imagine if tomorrow I start saying where you live is the most polluted place in the city, you might get scared not to live there
and run away.
Yeah, but if I tell you that, look, in Makerere there's better air quality and this is what they are doing, maybe you could try to do it in another location, then I think that could inspire action. So we hope that our data can actually be used to inspire action and not scare.
I understand why you are acting diplomatically, because you have a lot of enemies in terms of landlords and etc. When people run away from the apartments, if they hear that the quality of air is actually very bad.
Yeah, but I think in the end, it's we cannot run off from it, because in the end, the data is available, science is available. It shows that if you breathe polluted air, your health is impacted on. So we cannot, hide away from that. This is the fact. We know that, if you live in Kampala, you are exposed to higher emissions than if you live maybe in an upcountry place. So I think the numbers are there. But in the end, I think what we want to see is that, yes, we have the numbers that are saying, and people are taking decisions based on these numbers, but we also want to ensure that when people see these numbers, they can actually see the possibility on what they can do to improve their air quality.
Back to these machines that you use to gather data, but also the apps that you have created for people to use. How ordinary are these apps for a very ordinary people to understand and use them?
Yeah, so one of the things we did is that, when we talk about the data that we collect, these are just numbers. And when I was looking at our data store, we probably have close to 400 million of records of data. These are huge numbers. But as they are in a raw form, these are numbers, 10, 15, 10.5. These are huge and many and largely incomprehensible to an ordinary person. So one of the things we've been trying to do, and what we've actually tried to work with our users, is what is the right way to present this data to you as a user, so that if you look at it, you can be able to interpret. For instance, our mobile app, if you get to a mobile app.
With the mobile app, you can get it on Play Store or for Android, and App Store for iPhone users. So this is how the mobile app looks like. When you download and install it, you're going to register. These are the features you're going to see on the mobile app. So we have the near you section, favorites, the different countries where the monitors are installed. For the near you section, like maybe places that are near you, that are surround you. But for example, I want to know air quality of Makerere University, because right now I'm in Makerere University. I'm just going to go to the search feature and then type in Makerere University. It already appears, but you can just type in Makerere University and then it will come, or any location that you want. All the suggestions will come. But since I'm in Makerere, I'm just going to tap here, and then it shows me the air quality of Makerere University. So it also gives you the forecast version, the same way we forecast weather. So the app also, using AI of course, we are able to forecast the air quality of the area we are in. You can see today is Tuesday, the air quality is moderate, and they are telling us that tomorrow it's going to be moderate. It's not certain that tomorrow is going to be moderate, like forecast. They may tell you it's going to rain tomorrow, but then it doesn't rain, so it's just a probability. So it's the same for the air quality. And then when you see that it's moderate, they give you a tip for that day. How are you going? What is your health tip for that day? So today's health tip is take it easy and limit the intensity of your outdoor activities. Maybe if you were planning on running that day or anything. So you can also plan your activities based on how the air quality is that day. But if it turns red, I'll just go to the AQI index. This is the AQI index. It's the air quality index. So it shows from green to purple. So every color here represents how the air quality is for that day. Not for that, like if you see at color here in your area. Green air quality is good. Yellow air quality is moderate. Orange unhealthy for sensitive groups. Those are people with asthma, pregnant moms, those special cases. Red, it's unhealthy. It's unhealthy for everyone. You get cough, it chokes your throat. Yeah. And then this is purple. Yeah. And then this is hazardous. The area is very toxic to everyone. So that is the search feature where you can be able to know how your air quality is. And then the learn more. For example, you want to share the air quality message with people around you. You'll go to the learn more. It also helps you understand how you can best present air quality in your regions. This is mostly used by the community champions you work with. So in the learn more feature, it gives you actions you can take to reduce on air pollution. You can tap on it and then it gives you some of the basic things you can do to reduce on pollution. You can use public transport, service your car or border regularly, avoid idling your car, engine in traffic, walk or cycle, avoid burning garbage, cut down on single-use plastic products, become an air quality champion. So all these are things you can do to reduce on the pollution in your area and more. Yeah. So that is it mostly for the mobile app.
Once you install the app, one of the things the app will ask you, of course, is to personalize. What's your profile and so on. Where do you live? And those kind of, or which locations are you interested in? You might have a place where your child goes to school too. Maybe you're interested in the air quality in that area. You can have it as a favorite area in your app. And in this app, what it shows you, it will be kind of color-coded information. When you see red, you know that this is unhealthy. When it's green, it means this is healthy. If it's yellow, it means it's moderate. So we have different color codes that I've tried to explain this. But also what we try to do is that we empower you. Yes, when you see it's color coded red, there has to be advisory. Like we provide advisory that this is what you can do. For this kind of category of users or groups of people, you should minimize exposure in that area. But also we provide a few hints in terms of what can you do at individual level to actually contribute to cleaner air in your neighborhood. So that's the targeting the users, ordinarily the everyday person on the street. And we've tried to translate this for different countries. Like for instance, Cameroon, we found that they speak more French, so they wanted the app in French. So we made it available in French. Went to Mozambique, they wanted it in Portuguese. We translated it in Portuguese. Went to Kenya, they wanted it in Swahili. It's available in Swahili. So we're also trying to make it available in different languages. That's for the users. The other one is targeting people who actually, I think they have the biggest responsibility to manage our air. That's our city authorities and the governments. So we have an online analytics platform. For them, they want bigger insights. It's not about how is the air quality at this school where my child is going to. No, for them, they are responsible for managing our city. So we want to give them insights. How is the trend of air quality in Makindye comparing to the one in Nakawa? Or how many times did the air quality in Nakawa exceed the guidelines compared to this other suburb? So we hope this information can be able to help them to actually make high-level decisions, because we think that given the importance of air quality, for sure, if you want to, because we know what is causing our emissions: unpaved roads, dust from the road. So if you are in charge of our road infrastructure, I think you should prioritize paving roads in places that have high pollution, so that people there can have clean air. On the other hand, also we can be able to see the actions they are taking. If a city introduces a corridor where vehicles are not allowed, we call NMTs, can we actually see that there's evidence that when you do that, the air quality improves? So we give them that dashboard for that. The other category of our users, these are people who build tools. We provide what you call an interface, an API in a technical language. And what this basically does is that if you're building, you might be building a service maybe that provides bookings to a restaurant or bookings to a hotel, and you want to ensure that people can know what the air quality is at this place you are recommending them to book. So you can integrate our API or data into our platform. And we've had some engagements. For instance, we have had collaborations with some of the agencies in town, like Mobicast, where they've been able to kind of broadcast air quality on some of their big screens in town. So we hope we can provide this data in different formats, that people can consume it in a way that's best understood by them, but most importantly, enabling them to, of course, protect themselves against exposure, but also empowering them to take action to improve air quality.
Back to the issue of languages, asking for the very, very ordinary Ugandans. We know there are many people on social media platforms like TikTok, which has become a big thing now, who don't speak English. There are many people who speak Runyankore. You have translated the app into major languages spoken across the continent. When are we going to get this information in Runyankore, in Uganda, and many other local languages, so that the very, very ordinary people can understand what is air pollution, what is air quality, what can I do?
Yeah, that's interesting. I think that's still our work in progress. Of course, I think I would want to explain what particulate matter is in Luganda or Chole or Runyankole. We haven't gone that far, but the good news is that technology is evolving. I think language technology, particularly, it's something I'm very excited about, and I know that very soon we're going to have tools supporting real-time translation of information in multiple languages. So that's not far off the line. It's something that we are very passionate about. How do we ensure that this information is in formats that are actually understood by many people, not only through the translation, but also the channels of how the information is actually made available. I mean, our primary targets now is the digital platforms like the mobile app, the web app, but there are a number of people who are not connected on the internet, are not connected on the smartphones, and so on. So how do we reach that audience? We've done a few pilots, for instance, with radio stations, where we engage radio presenters to talk about air quality with their public, the same way people share about weather information on radio stations. I think we'd want to ensure that this is also air quality becomes a big part of the data that is given to the public.
Okay, that's nice. We have talked about 10 years, the first 10 years that you have been working on this project and interacting with various people across the continent. What do you say, what are your hopes for the next decade? What do you think will change across Africa?
Yeah, I think there are two things. One, I think, is optimistic, is that we see that most African cities are starting to actually track the air quality, thanks to our technology and the scaling that we are doing. We see there's a lot of demand in terms of actually monitoring the air quality. I think if we continue at that pace beyond the monitoring, then we actually now see more of the action to improve the air quality. So I think that's the good news. And in terms of what we want to see as AirQo, as by our vision is clean air for all African cities. We really want to ensure that everyone can achieve clean air, and that's our vision. If we can achieve that, I think we can close AirQo. But that said, the other angle to this is that cleaning up our air quality is going to take many years. We have to take consistent steps for many years. But this is possible. If you take, and we have many examples to showcase. If you go to London, for instance, they will tell you, I think in the 1960s, they had what you call the London smog, where, if you seated here 1 meter from me, you could not see me because of coal burning and all that, and many people died, respiratory illness and so on. But they were able to transform that, with time, regulations, reducing of the coal use and all those things, and air quality became clean. The US, the same thing. They also had an issue where the pollutants were getting high, and they enacted the Clean Air Act in the US, which sets very stringent, regulations on air quality. And also over time, now they are able to, achieve that. So I think there are many examples, elsewhere that show us this is possible, but this will not happen. I think we have to, double our effort in science and technology, but also our action from policy, government and the population.
For those policies and actions to happen, you people who gather all this data, you should have reached all corners of the continent, perhaps. Do you think you are going to reach all 54 African countries in the next 10 years?
That's the ultimate goal. I think the ultimate goal of AirQo is that every individual on this continent can have the ability to track the quality of air they breathe at any one moment. Because we believe if everyone can track the quality of air they breathe, then that's one way also to get the citizens actually demanding for actions from our governments and scientists as well. Because if people become aware and they're empowered, I think then it becomes easy for us to push for action, either individual action, but also the collective institutional or government actions.
I hope you are going to lead us to achieve that goal. And it has been a pleasure hosting you, Professor. Thank you.
Thank you so much, and really welcoming you to join us on ensuring that everyone can breathe clean air in Africa. Thank you.
I guess to begin, AirQo, we have a plethora of products that we develop, all towards one goal, which is collecting data about air quality in a specific region. One of the products which is, I would call a base product, one of the products that collects the data is the device. An overview of the whole process is, so these devices collect the data, and this data is collected, it passes through our calibration models, and then it's dispensed to the public. So one of the ways dispensed is through our mobile application and our online dashboard. So I think this is one of the online dashboards which shows all the different locations where we have monitors across Africa. Probably I can get an overview. So yeah, so if you look at the whole map of Africa, you see each node. You can see, like, maybe here in East Africa we have over 200 of them. But yeah, each node is a specific point with an air quality reading at each moment. Then, so this is one of them. The other is the mobile application. So I'll be taking you through the app, the device itself. So for the device, we have the electronic components on it, which is a PCB and a microcontroller, which is like, I'll say the brains of the whole thing. It's what collects the data and sends it to our online platforms. We have SIM cards and different communication models on this. We can communicate via Wi-Fi, LoRa, and also GSM communication, which is the same as phones. But yes, this sensor specifically is what we call a PM sensor, and it uses light to tell how much dust particles are in each cubic meter of air it takes in. So it will be able to tell how many particles are in that, and then from that we can tell that this is the air quality of a specific location. So yeah, the data collected from here is then taken to our online models, which calibrate this. So right there we have a reference grid monitor which gives the accurate readings, but these have a slight error drift of that. So these are calibrated with that and taken to the field, and then when the data is collected, it's calibrated again to make sure that we meet the industrial standards before this is dispensed to the different people. Yeah, I guess that's it.
One question is, for those components that make up that air quality monitor, which one is made here? What do you import?
So I guess this is what we import. Okay, all these products are made in China, of course, but this is designed by us. So what we'll do is we'll design this PCB to make sure it fits our needs and it's durable for the African context. Same with the casing and all that, and then they're assembled and returned to us. So what we'll do is maybe design the PCB for it and then design the casings. So right there, what you're seeing is a PCB, a casing being made, and those casings are what we use for this here. So the casings are made here, designed here. The PCBs are made abroad, designed here still. A PCB would be a combination of all the electronics that are on this board. You have the microprocessor. Let me give an example of like a phone. So all phones have the microprocessor that they hold plus the different sensors. So that's what this would be, right? It has the main microcontroller, which is what does all the processing, collecting the data, and sending it to our online platforms. And also has the PM sensors. So the PM sensors would be specifically sampling the air at every interval that we set, and then from that it sends the data to this, and that's transmitted to us. Then for the casing would just be like basically the shield for the electronics. So this is designed in a way that it's built to stand the African context, because we have a lot of dust here, a lot of dust and varying weather. So you realize that some of the designs we put on this are to make sure that these don't get spoiled in a short period of time. Also is to make sure that we get as accurate readings as possible. So you can see here, this is a temperature humidity sensor. This is placed on every electronic usually that comes, but it's placed outside so that it can get as accurate readings as possible, but still be shielded from the rain and the harsh conditions of under. But then the casing is basically just the shield for this. Yes.